Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're continuing our inhaler series for asthma. Asthma is one of the most common allergic diseases affecting both children and adults, and inhalers remain the foundation of treatment. They are widely used, well-studied, and proven to be both safe and effective. While I have previously covered nearly all FDA-approved biologic therapies for asthma, this series shifts our focus back to inhalers, introducing them one by one. In this episode, we're focusing on Arnuity Ellipta, an inhaled corticosteroid dry powder inhaler designed for convenient once-daily maintenance therapy. It is approved for patients as young as 5 years old and comes in 3 strengths, 50, 100, and 200 micrograms, allowing flexibility based on age and asthma severity. In this video, I'll walk you through 5 key things you need to know about Arnuity Ellipta: what it is, how it works, how to use it, important warnings and precautions, and its safety profile. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Arnuity Ellipta and who is for? Arnuity Ellipta contains Fluticasone Furoate, an inhaled corticosteroid approved by the FDA for the maintenance treatment of asthma in both adults and children ages 5 years and older. It was initially approved in August 2014 for patients 12 and older, with an expanded indication in May 2018 to include younger children down to age 5, making this once-daily option available across a broad age range. It is important to remember that Arnuity Ellipta is not a rescue medication. It should not be used to treat acute breathing symptoms or asthma attacks. Instead, it is taken regularly to reduce airway inflammation, improve lung function, and lower the risk of flare-ups over time. Patients should always have a separate rescue inhaler available for quick relief when needed. Second, how does Arnuity Ellipta work? Arnuity Ellipta contains Fluticasone Furoate, a corticosteroid that helps control the underlying inflammation in asthma. Asthma is not just about narrowed airways. It is also driven by ongoing inflammation. Corticosteroids work by targeting that inflammation, reducing the activity of immune cells and inflammatory signals involved in both allergic and non-allergic asthma. Because Arnuity Ellipta is delivered directly into the lungs, it acts where it is needed most, while overall exposure to the rest of the body remains low. It's also important to set expectations. This medication may not work immediately. The maximum benefit may take up to 2 weeks or longer, and the timing and degree of symptom improvement can vary from person to person. Third, let's talk about dosing and how to take Arnuity Ellipta. Arnuity Ellipta is taken once daily by oral inhalation, ideally at the same time each day. It should not be used more than once in a 24-hour period. Arnuity Ellipta comes in 3 strengths, 50, 100, and 200 micrograms per inhalation, allowing dosing to be tailored based on age and disease severity. For patients 12 years and older, the recommended starting dose is either 100 and 200 micrograms once daily, depending on prior therapy and asthma control. If symptoms remain uncontrolled, after about 2 weeks on the 100 microgram dose, increasing to 200 micrograms may provide additional benefit. For children aged 5 to 11, the recommended dose is 50 micrograms once daily. If asthma is not adequately controlled despite treatment, the management plan should be reassessed and adjusted as needed. And once good control is reached, the goal is to carefully step down to the lowest effective dose to minimize potential side effects. Proper inhaler use is essential. Correct priming and inhalation technique are key to achieving full benefit. Detailed instructions are available in the Instructions for Use section of the package insert and on the official website. Extra caution is also needed in certain situations. Patients with moderate to severe liver impairment may have increased systemic exposure to the medication and should be monitored for steroid-related side effects. In addition, strong CYP3A4 inhibitors, such as certain antifungal medications or HIV treatments, may increase systemic exposure to fluticasone furoate. Reviewing all medications, over-the-counter products, and supplements with a healthcare provider or pharmacist is always recommended. Fourth, let's review important warnings and precautions. Hypersensitivity reactions, including anaphylaxis, may occur with Arnuity Ellipta. If symptoms such as trouble breathing, skin rash or hives, or swelling of the face, mouth, and tongue occur, stop the medication immediately and seek emergency medical care. Arnuity Ellipta also contains lactose, which may have trace amounts of milk protein. Patients with severe milk protein allergy should not use this inhaler. Sudden worsening of breathing, coughing, and wheezing, known as paradoxical bronchospasm, can occur with inhaled medications. If this happens after using Arnuity Ellipta, treat it right away with a rescue inhaler. Arnuity Ellipta should be stopped immediately and alternative treatment should be used. Because Arnuity Ellipta contains a corticosteroid, it may affect the immune system and increase the risk of infection. Patients should avoid exposure to contagious illnesses like chickenpox or measles and discuss any past infection or exposure with their doctor. Inhaled corticosteroids should be used with caution in people with current or past tuberculosis, untreated systemic fungal, bacterial, viral, or parasitic infections, or herpes infection of the eye. Furthermore, inhaled corticosteroids can cause a fungal infection in the mouth or throat, called thrush. Rinse your mouth with water and spit it out after using Arnuity Ellipta to reduce this risk. If thrush develops, treatment may include antifungal therapy and temporarily stopping Arnuity Ellipta. Using Arnuity Ellipta at high doses or together with other steroid medicines for asthma, allergies, or skin conditions may increase the risk of systemic steroid effects, including hypercortisonism and adrenal suppression. Patients should be checked for other steroid use and monitored for these effects, and treated if they occur. Long-term use of inhaled corticosteroids like fluticasone furoate may contribute to the development or worsening of glaucoma and cataracts. Patients who develop eye symptoms or are using Arnuity Ellipta long-term may benefit from regular examinations by an eye specialist. Any new or worsening vision changes should be evaluated promptly. Furthermore, prolonged use of inhaled corticosteroids may lead to bone weakness. While the impact of small changes is unclear, people at higher risk, such as older adults, postmenopausal women, smokers, those with poor nutrition, limited mobility, a family history of osteoporosis, or long-term use of medications that cause bone thinning should be monitored for bone loss and treated if needed. Lastly, corticosteroid may slow growth in children. Pediatric patients should be kept on the lowest effective dose needed to control symptoms, and growth should be monitored regularly during treatment with Arnuity Ellipta. And finally, let's review the side effects and safety. In clinical trials involving adults and adolescents 12 years and older, using the 100 and 200 microgram strengths, the most commonly reported side effects were runny nose, sore throat, headache, respiratory tract infections, and breathing problems. Overall, many of these were generally comparable to what was seen in the placebo group. Longer-term studies, extending up to about 1 year or more, showed a consistent safety profile with no new concerns identified. Drug discontinuation due to side effects was low, around 2% in patients taking Arnuity Ellipta compared to 1% or less with placebo. In children ages 5 to 11, using the 15 microgram dose, the safety profile was similar to what was observed in older patients. After approval, additional adverse events have been reported through post-marketing experience with Arnuity Ellipta. Although it is difficult to determine how often this occurs or whether they are directly caused by the medication, these reports highlight the importance of stopping the inhaler and consulting a healthcare provider if new, persistent, or worsening symptoms develop. And there you have it, 5 key things to know about Arnuity Ellipta, a once-daily inhaled corticosteroid that offers a convenient approach to controlling airway inflammation, improving lung function, and supporting long-term asthma management. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experiences in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.